So you will have collected, or somebody will have collected, hearing aids to be cleaned either from our mailbox drop-off thing or from somebody who's waiting in the parking lot in the car, and it will be on this tray. And if it came from the mailbox, it'll be in a bag like this. If it came just from the patient, you're gonna have them put it in. See how that gives me, 2.5 feet, a foot and a half. They're kind of 2.5 feet, and we're keeping our distance. So, but they're contaminated, right? So what are we gonna do about that? Well, you're gonna come here. You're going to open the bag. You're gonna look and see, is it really, really gross, dirty, and you need to wipe it off, in which case, of course, wipe it off. And if it's not, you're just gonna kind of poop in there. And if it's in a bag, to kind of kill some germs on the outside, we're gonna put the bag in there. And we shut it, and we run it, and we clean it. And guess what we do? We hand sanitize. Now, if you want to wear gloves, you are perfectly fine to wear gloves, but anytime you change contacts, you have to wear gloves. So you have to switch gloves. That's proper. And just in case, I did speak to actual medical professionals, nurse practitioners, and they verified for me, do not hand sanitize gloves. Do not cross contact with gloves. There is a little bit of data about if you actually use soap and water on gloves, that's okay. But hand sanitizer on gloves is a no. Cross contact with gloves is a no.
And so literally, guys, what she's saying is if you had on gloves when you were putting that in, now you're going to have to take the gloves off.
Get some fresh ones.
And then take it out because you have changed what your contact was with that and when it was in a different state, even because you're now cleaning it.
And on the cleaning of the things, the thing I did forget about was we need to also sanitize the contact positions on this. Everybody makes mistakes sometimes. So this doesn't kill COVID, but it's what I have right in front of me, so I'm going to use it more of a barrier to opening. So this is now sanitized on the outside, and the bag is sanitized on the outside, not the inside. Please do be aware of that. And then you'll take it to your cleaning area, freeing up that space for the next person who needs to use it. So you have to gauge like what your level of sanitation and touching was of this, whether or not the tray is contaminated at this point. I had already sanitized before we started. I haven't touched anything or gone anywhere. So we're gonna proceed from here. And
I apologize for my hand bobble, y'all.
we're doing
not
the
a
best
camera
we
woman.
can. So there wasn't like big grunge and grime, but just in case, we're just gonna wipe this off. If you didn't use the sterilizer, or you didn't have, or you saw something that was unexpected, you can always grab the COVID wipes. Now the thing about the wipes is how much time it takes. So they are like 2 or 3 minute contact. So if you were sanitizing something with it, you need to wet it, keep it kind of, that's the hearing aid. It like caught its battery. So you need to like wet it and like let it sit there wet for the 2 minutes. So I wipe it, I fold it up into the cloth so it keeps the moisture level there. And guess what you can do while that's waiting? You can wash your hands. Now, if you're by the sink, happy birthday to you, happy birthday to you, happy birthday, dear COVID, happy birthday to
Let's not wish
you.
COVID a birthday.
I'm hoping for SIDS. Happy birthday.
Or you
to
could sing
you.
the chorus of
Happy
Jolene
birthday to
a couple times.
Jolene, Jolene, Jolene.
Who says we don't have fun in audiology?
Oh, why did I know why it went, because I've been listening to the Eldritch horror version of Jolene.
Hey.
And, so I've gone all the way up my wrists, I've gone all the way around, I've gone in between them. I don't know how well you could see that I've gotten in my fingernails. I think I've covered all the things. Did you see me miss any spots?
I don't think so.
So now we can rinse and go. Now, if you're wearing a band, you need to be like working on it. The band can go in the UV sanitizer. It can go in the sonic cleaner, or you better be willing to let it get soaked and watered like that.
Yeah.
If you need to have it on you. If you don't need to have it on you for some reason, I suggest not wearing them.
We're going to recommend not wearing them unless you have an absolute reason, or you have something, again, that can be sanitized and is safe to get cleaned with sanitation.
So,
but as much as you can limit jewelry, watches,
and I'm married
what have
and normally
you.
wear a ring, it comes off.
Yes, we're going to recommend.
This is keeping track of my heart rate because I'm having some stuff, and it's also connected to my phone so that when I get pinged that somebody's in there, I can do. I don't touch it. You notice you haven't seen me click, clack, touch it.
Right.
And also, it's a metal band that I can take off, and I throw it in the sonic cleaner on the regular. You may have noticed I grabbed a paper towel. I shut it off with the paper towel because remember, my hands were dirty when I turned on the faucet, and I folded it back up so that it didn't cross touch.
And while you have your beautiful watch where everybody can still see it, I also want to say that if you have a cloth or a leather band,
that's going to be
it's going to be a no-no. And the reason it's going to be a no-no is it's going to contain germs in a different way, the porous surfaces, etc.
Uh-huh.
So we're going to say nope, unless it is some sort of
rubber metal.
Silicone, metal, that sort of thing that can be cleaned.
Okay, so this is probably good. Now, you can clean an ear mold in a sonic cleaner. You can clean them with the wipes. You can do. So this is all nice and clean. You know what I should have done? My mistake, because everybody's still trying to, but I'm going to need to get parts for this to replace. Now I've touched things and I'm pretty sure I cleaned it good, but how good did I really clean it? I don't know. So your best bet is actually after you've washed or sanitized your hands, don't touch anything except to the parts that you're going to need. So hand sanitize because now I'm all paranoid. Your different kits are going to look a little different from what you're going to see right here. Do familiarize yourself with them ahead of time. So this is a standard behind the ear hearing aid. Looking at it, I'm going to need some ear mold tubing. That's going to need a TRS tubing, and it needs some of these filters, and it needs an ear hook. So I've got nice clean hands.
And I will say, normally we would encourage you as students to go find those, even if you're not 100% sure to look and dig and what have you. But because of COVID, if you have not familiarized yourself with it beforehand and your supervisor is handy, ask them to take a look at it with you so that you can grab only the specific parts you need, just because.
To minimize. Now, if you pop into this tray and look, we talk about ear hooks as male or female, innies or outies. So this is, if you look, you can see the threads are on the hearing aid, and the ear hook, the clear part, goes over it like this.
Right, so your ear hook in this case is your female.
It's the female.
Hearing aid is your male because it has the part that sticks out with the threading that you need to connect
and it has a filter, and it's kind of smallish. So let's look in our box. If you look at this bag right here, you can see that's a male ear hook. I don't need to touch it.
Right.
If you look over to this one, and these are going to be our female ones. This is the big one. This is the small one. So we're going to look at that and see how that's a match. And with my nice clean hands, I'm going to pop one out. And then we're going to do some clear tubing, and I want TRS tubing because it's a soft ear mold. It's a flexible ear mold, and TRS tubing comes in size 13T or double T. That means thick or double thick. And it's TRS because it's got this little lock to add friction. So we've got that. We've got our new ear hook. We've got our new tubing going up the thing. We also need some filters for that. And they look, for this particular model, they look like this.
And that one has 3 filters, one on the battery door and 2 on the microphone covers.
So we can pull some of those out and put that back before I touch other things. There's a couple of different ways to get this off of here. I'm going to show you the way that is not necessarily OSHA approved, but it's the way that works for me. Be careful. So we have all of our parts, right?
Yeah, and I'm going to go ahead and tell y'all, she said it might not be OSHA approved, but I would say 85% or more of the places that I worked used razor blades to remove them.
Yeah, they're pointier than the tools. They cause less damage. So what I'm going to do is I'm going to use my towel that I still had here, and I'm going to unscrew this ear hook and tubing. And there's no point. Every time you clean one of these, every single time, you're going to replace the ear hook. I don't care if they did it just last week. They're either free or a nickel. Why waste? Now, if you look and you literally don't have an ear hook, okay. But otherwise, replace it every time.
And that brings up an excellent point, boys and girls. When you see that we are low on any specific supply, this pretty lady needs to know.
And you're going to put it in the chat, the team chat for clinic.
Yes, and if you don't, and we find out you're the last one who did it, we're going to give you grief.
And we're going to know, because each pod has their own supplies now, so you can't hide it. So I used the corners to flick these up, and I did it from the inner part because the microphones are on the outer and I didn't want to dig in, right? This one also has, you can see how this part opens. All of this is opened. So now I've got everything open, and I can come over here and I can use this vacuum, and you start at one end. I'm very big on being methodical, so always don't do things haphazardly. If you're working on something, work at one end and work your way down. When you write notes, say, you know, ear mold was clean, tubing was replaced, ear hook was replaced, microphone protectors were replaced. See how I started at one end, and hearing aids were vacuumed and cleaned. But start here.
And that makes an excellent point while she's vacuuming, that when you're making these notes, it is probably, in my opinion, even more important now with the current COVID situation that you literally tell every piece of every step you did in these cleanings, because you want to make sure that you are personally covered for what you have performed for that patient, what services you performed for that patient. So no one can come back and say, well, they didn't this, they didn't that, and I think I was exposed to something because of them. We want to make sure that they know we've taken every precaution at every step to make sure every part of this is as clean as possible as we can provide for them. She is getting the gunk out.
So the one she was talking about in the battery door.
Oh, hang on, there we go.
The one she's talking about in the battery door, I don't use a razor blade on that. I use a pushy.
And the reason you can do that is it's open from the inside, so once you have your battery door open, you can literally just push it out. It doesn't have something behind it like the microphone.
And then you'll take the needle off, and it'll go in your bucket of dirty to be sanitized. So then we work our way kind of back. We put an ear hook on. We put these filters on, and the trick to it is it has a non-sticky end and a stickier end. You want the non-sticky end to line up above with the ear hook, and then you sit it, and see, they're built to fit directly on there. and you rub it on good, good, good. And then you put your thumbnail under here, and see, you kind of just push down on the filter and pull up, and your other finger is keeping the next one.
And these literally just fit in tightly, so if you don't have them in well, they will pop right back out.
So we take that off, and then used to be we would save the other one because I'm cheap that way, but now we're adding touches and contact points. We're just going to waste it.
I really wish they had it where it was set at 3 because they know so many other products are this way. And she's just pushing it in on the base of the hearing aid where it goes into the battery contact. And that's just a filter to prevent gunk from getting in there with the battery.
So there we go. Now, we'd also wiped down this ear mold, and it had also run through the UV, so it's pretty clean. Now, what you need to do is feed, it's kind of like sewing thread.
Get it to clear up on, there you go.
So see how it's got a kind of sharp end? You want to push it in through the face of the ear mold and the top hole. It's always the top hole, never the bottom hole. The bottom hole's venting. So you push it through, and you want to line it up so that when it stands up, it's going to be going up this way, and this little bend is going to nestle here. So you run it through.
And in most cases, you're going to be able to push it through. There are tools that if we need them, she's going to show you.
If you need to, do not yank like this, right? Don't grab this end and just yank. What you want is to grasp it firmly, pull it a little bit, and twist. See how it's kind of doing? And pull it a little bit and twist. That way the tubing helps hold itself on there, and you have more leverage. And watch, slow, slow, slow. See how this tubing is forward? And I'm pulling it, and it stood up. That's your stop point. See how this little is nestled in here?
And one of the things that she hasn't said, but if you yank on those too hard and that ear mold is not a newer ear mold, or it's had some, you know,
it'll rip,
wear and tear, it will rip,
break.
And yep, you don't want that to be on your...
Now, if it is a hard ear mold, you would use the razor blade. Since it is a soft ear mold, you're going to use the nippers, and you need to notice that there's a well on one side and a flat on the other. The flat needs to go on the end of the ear canal, and you're going to push it. And again, notice all of my work pretty much has been here on this tray. So you put it in and you get it, and you don't close it tight. You just wiggle, and see, I'm compressing the canal down. I haven't clipped it yet. I'm compressing, and then I clip so that when the canal bounces back up, we have the tubing is recessed or flush with it, and it's not going to do. Now, if you're not sure if it's rough, you want to try it on your inner wrist to make sure it's not rough. But that's pretty good. Now, best practice would say, put this ear mold in the person's ear and measure it. Obviously, best practice in COVID is don't stick your face in somebody else's face. So, notice how much thinner and smaller this old tubing is.
And it's trying to, there we go.
Than the new. It's stiff, it's shrunk, they shrink. So, we'll slide this over so you can get in here. You want to line them up. Bend to bend, end to end. And you can either use the nippers or the razor blade here, but remember, it shrank. So you need to give it a few extra millimeters. We can always cut more off. We can't put any more on. So, see, it's a little bit longer.
And I would say that's a pretty common mistake early in, is that you'll think, oh, well, I'll cut it shorter because I don't want to have to take it off of them and do it again. But what's going to end up happening is it's going to be too short, and then you have to completely retube.
Or they don't think it's too short. They go out in public and they go out in the world and they end up with a sore. And our patients are often the patients that don't heal well. Now, this is a left hearing aid and a left ear mold. So if you're bad like me and think, I can't tell left, right, how do I do? we're gonna come at it from this way. You kind of line the hearing aid up like it would sit on your ear, and then the ear mold needs to point towards your ear. I have to line myself
Sort
up.
of self-orient to make sure that you're putting it in the right
And
direction.
then to get it in, best to not use tubing expanders if you don't have to, because they tend to want to come off. So try first. You kind of wedge them in at, I don't know, it's not a 90-degree angle. It's more like 115-ish. And you kind of wedge that in like this. And it kind of opens it, and then coming from like a millimeter at a time, you slide it up.
And I will say that in most cases, you're going to be able to get it on that way. There are some rare cases where you can't, and that is when you will use this.
And you just literally shove it in the tubing and expand it.
Yeah, so like here's an
Yeah.
extra piece of tubing. We'll just show you real quick.
You kind of put it in and you slide it up.
And then you squeeze and it essentially stretches. But see how it stretches? Let's see if I
It
can
stretches it big and a lot.
And when you're talking about people who are yanking off their hearing aids inappropriately
Or right now with masks.
Yep.
I do not want you to use this if you don't. So part of your kit is going to be a dummy hearing aid with some tubing so you can practice this. All right? Get good at doing it the way you just saw me doing it without using a tool. And you'll get a full piece of tubing. And what I want you to do is put the tubing on a couple of times until it gets easy. Cut just that amount off and do it. You could get a dozen to 20 tries on the same piece of tubing.
Yeah.
All right. So now we have this hearing aid. It's all cleaned. All the parts are done. We're going to redo that. I have no clue what all I've touched. It's never bad to hand sanitize in the middle of things.
Well, she's got that battery in there. Y'all hear it? And one thing I am going to say, which is not anything that you care about at home, is that my battery just let me know it's low on my phone. So hopefully we can finish this up before it decides to die.
So to do the listening check, you want to hold it over your finger like it's a ear and orient it like a real person will wear it. Not down, not sideways. Don't cover it with your fingers. Put this on and sit it like it was a person you were talking to, right? And it's a, e, u, sh, it, Did I miss any of the letters?
U, e, a, sh, s, m, and they've added or. So
Or,
now or is the other sound. The Ling 7.
I do I and t because you get weirdness with frequency compression on t, like s and sh. So I like to check that one.
But at the very least, make sure you're doing the Ling 7. If you want to add those, that's excellent too.
But the or is new and I'm an old lady, so I'm still...
U, e, a, sh, s, m, or. And it's fine to say things like testing and what have you, but it's not going to give you the same information. And we'll be talking in hearing aids class about why those sounds are so important. But really, it's that it's a broad range of frequencies.
And if you want to do words, pick words that have the ling sounds,
Yep.
like fish sticks.
Yep, perfect.
S'mores. Things like that. So we've have the outside of the bag had been pretty good and sterilized. We kind of didn't put other things. Now this can be put in the bag for Tammy. And we would normally just go ahead and take this to her. But for right now, I'm going to set this. I'll clean this later. I'm going to set this up here out of the way. So we have all of this stuff. This is going to go in the dirty bucket. The rest of this stuff is going to be put to clean, like line out the things that are going to be cleaned. And the trash is sitting here separated and it gets dumped in the trash can. Now, we have surfaces that now need to be decontaminated. Trays could go in the Sonic Clean, in the UV cleaner soak in these, but you can also spray, saturate it, right? I'm bad. This is like a thing that I'm not good with. I'm just like, I'm gonna die of cancer anyway eventually. So I'm bad about not grabbing the gloves.
If you're
You
using
are supposed to
Cavicide,
do Cavicide.
This one.
The Cavicide spray, you're supposed to wear gloves. And gloves should fit
Very
tightly,
snug.
like this.
And if you have baby hands like both Dr. Burns and I do, you'll probably need the
smaller,
smaller
extra
extra smalls. But we do have all the way up through an extra large, correct?
Yes. And I am much better at using my left hand to put on a right glove than the vice versa.
You're getting there.
There we go. Now, this right now, you don't have to be so careful on the donning because we're not using it to be sterilely touching. We're using it as protectives. So we've sprayed. Yes, even a razor blade if you're going to use it more than once. Both sides of this. Obviously don't spray in the middle of the bags. That's why I'm like, be clean before you touch it. But the exterior, sure. So everything's been sprayed and it needs to sit for 2 to 3 minutes. Let's double check on this. 2 minutes. Visibly wet for 2 minutes.
At room temperature.
At room temperature.
Boom.
So 2 minutes for this spray. The white buckets that Lamar's putting out, 10 minutes for the wipes. Imagine the difficulty. These are, let's see if we can't find it. 2 minutes.
Yes.
These are also 2 minutes. Hence why I wanted it folded and staying damp the whole time. The purple ones, I think, are 3 minute time.
But always check your instructions. If you
If you're not
forget,
sure.
it's fine. I know I forget. Just make sure you're taking a look at that. And we let them sit. And once they have sat, they will then, you'll grab some paper towels.
Now, there is a step of pre-cleaning. If you had like soiled area that you thought had debris or gunk or slime or anything like that, you would quick spray or use a wipe. The time doesn't matter, and then you would respray. That's pre-cleaning versus, but you saw nothing was like it had already been recently sanitized. We're cool to skip the pre-clean at this point in time. And we wipe it.
Until dry.
Or mostly dry. Now, if I had managed to be a little bit more circumspect in the space I had and didn't use tools, I would have much less to clean. So, think about what you're doing. Normally you would sterilize this in between, but I'm still waiting on that order to come in. So this has been sanitized and I'll come back to it. Razor blades, super careful. They'll be super careful with that. We're getting new Sharps buckets, but
Still, careful.
these you do not want to leave wet any longer than you have to.
They rust.
They do. Sometimes I throw them in the sonic cleaner though, because they're only like, I don't know, $5, $7, $15 depending. So to clean them, sometimes
if
I'll
you
ruin them
think
to
they
clean them.
have really nasty things that have touched their surfaces,
So this got some gross stuff on it at one point, and it went in the sonic cleaner. And that has to be wet overnight. And you want to wipe it kind of dryish and put it where it can hang up and be aired out. The edge of the thing.
all the stuffs.
All the stuff.
And the other thing you might not think about, and a lot of people carry around like their phones to use as their time and what have you. If you're touching that during all of this activity, you really probably shouldn't be. But that has to be sanitized. You need to be sanitizing as you go. If you have to wash your hands, your pens.
And the UV thing is for phones, keys, bands. If you have a thing that you need, you can use it.
As long as it fits and you're not
tablet,
shoving things
yeah.
in there that don't fit.
So all the things, it's slightly damp, but I'm going to be going on to the next thing. It can finish air drying. Then to get gloves off, you grab where, see how it's tight, and then there's a loose space right here. You don't want to grab it from back here where it's super loose. You want to grab it, can they see it from here?
Mm-hmm.
See how it's kind of a loose little pocket? Oh, also see what that chemical did to the glove? Can you see the discoloration?
It's making it yellow.
So that's what you're wanting to knot. So you grab it from there, fold it under your thumb like that. And then once you're here, you can kind of do this and have it upside down. And then you wad it in your hand like that. And because I have little hands and little gloves, I need to get it in really tight. Otherwise, when it's folding over, it won't go. And this I can, because now this hand, remember, it was clean before I put the gloves on and I put the gloves in. I can fold it in, and you want to get past the heel of your hand is what it is, what I'm doing. I'm pulling it as loose as I can. You twist so that you're only touching the inside, and then you can do. And then if you have any doubts on what you touched on the outside, hand wash. You can never hand wash too much. And this process, like I planned it out, and I still like sanitized hand wash, 4 times? Under non-COVID, when I'm like, yeah, I would like sanitize 11 times in that, because I'd be like, oh, I didn't grab this. Sanitize my hands. Oh, I didn't grab that.
Dr. Burns is our resident infection control crazy, and we love her for it, especially now that COVID's happening.
Also, I have a poor immune system, and the life you save might be my own.
And this lovely stuff
Is what I've been using.
is what she's been using, and we've purposefully picked this kind because it's not as likely as most hand sanitizers to dry our hands and cause them to crack and get, wore out. But if you happen to find that you are allergic to it,
We'll get
let
you more.
Dr. Burns know immediately, because there are other kinds that we can purchase, and we've had to do that in the past for other
Once.
students.
In the past decade, once.
Yeah, I think it was just one student, and then I've had some issues with it, but not as much as some people. But if you have sensitivities and you find that it's a problem, but that stuff, the greatest thing about it is it does not dry your hands out like most hand sanitizers.
And it keeps your cuticles nice.
Speaking of which, I don't know if you can see my fingernails. We're going to recommend you keep your nails short.
We are going to require.
Fake nails are not going to be allowed. I am so sorry, because I know that some people love them, but we cannot. It's a germ holder, and if you cannot, if you're gonna have natural nails, if you cannot keep them sanitized and clean throughout the day, then you don't need to have them. So we're going to recommend that you keep them short.
This is probably hitting too excessive, to be honest. I'm finding it difficult to properly wash them at this length. This side, this is a little bit better.
Yeah, and I keep mine very short. I just think that that's going to be easiest for me, but I am also not as full of hand sanitizer as Dr. Burns.
So that's that. And we'll get some more battery so we can do the next one.